The plantar fascia is a very thick tissue that runs across the bottom of your foot. And if it gets too tight and you've done certain activities, part of the fascia can start to pull away. And when you get little threads of the fascia that are pulling off, eventually you get some inflammation, and then the body's trying to heal it, but every day you get up and you step on your foot and you can tear those healing bridges. So it can be a very, very challenging to treat. Generally, the reason that we get plantar fasciitis is that we're putting too much stress on the bottom of our foot. And that relates to having poor flexibility of the muscles along the back of our leg, both the gastrocnemius, the hamstring, and not adequately firing our glute properly. So in order to treat plantar fasciitis, you have to go through the 3 R's. You have to relax the plantar fascia itself. You have to relax the fascia along the posterior or back of your leg and your thigh. And you have to reactivate the gluteus maximus muscle and your tibialis anterior. I think we've done a previous video where we showed how to use the tib ant to stretch the back of your calf. I would recommend viewing that and doing that exercise. But a couple of other things that I think are really helpful are first thing in the morning, before you even step out of bed, you can get a bottle. You can even put it in the freezer and get your frozen bottle, put it on the floor, and roll the bottom of your foot before you even get out of bed. And the reason for doing this is that you're trying to do some lengthening of the bottom of your foot, the fascia, before you take that first step on it. Because things can contract overnight and get tight. And if they get tight and then you step on your foot, then you can pull the area of the fascia that's also trying to heal. And that's part of the difficulty of this problem, because it's a vicious circle. So if you can stretch the back of your leg, stretch your gastroc just while you're lying in bed, roll the bottom of your foot, and then I recommend going and standing in your bathtub with about this much really hot water. And you can do, depending upon what feels better for you, you can do freezing cold water and then drain the tub and then put in hot water, and then do a calf stretch. You're going to stretch the back of your calf with your foot pointing straight towards the drain. Then you're going to point to that corner of the tub and you're going to stretch. And you hold it for about a minute. Then you're going to point to the other corner of the tub and you hold that for about a minute. And what you're doing by doing these stretches in the 3 different positions is you're stretching the different parts of the plantar fascia so that you get better faster. Once you've done your stretches, then what I want you to do is to sit and then activate your calf just by pushing down on your hand and pushing your toe up off of the ground. So you can see I'm raising my heel, and this just helps to get things firing so that so that you can walk with less pain.